Hello.
Good afternoon.
All right, looks like we have some folks trickling in. Hi, everyone. Good afternoon. Thank you so much for being here. My name is Emily Moore. I am the project manager of the Southeast Mental Health Technology Transfer Center, and I'm so happy to be here today for our second session in our 988 in Every State series that we are doing with our longtime and beloved partners at the Georgia Mental Health Consumer Network. We are going to be in the background just moderating and facilitating. So without any further ado whatsoever, I'm going to go ahead and turn it over to our friends Chris Johnson and Heather James. Thank you so much.
Thank you, Emily, and thanks to Emory and the Raleigh School of Public Health for supporting us as always. I'm Chris Johnson. I'm the Director of Communications for the Georgia Mental Health Consumer Network, and I am not going to talk a lot right now because we have a lot of people with a lot of brain power and a lot of knowledge and experience on this call that we want to make sure they have the opportunity to share with you. And but I will tell you that my role in the organization is just helping information like this get to you. My role in the 988 system is very limited, but the Georgia Mental Health Consumer Network did participate in the development of the 988 system over the past several years. The peer voice was a big part of the 988 development, and we were included at every step of the process, including now getting the information out to the public. So we're happy to be here, and I'm going to pass it on to my colleague, Heather James. Heather.
Thank you so much, Chris. Hi, everybody. Thank you so much for joining us. My name is Heather James, and I am the Chief Training and Development Officer for Georgia Mental Health Consumer Network. So my role is, like Chris says, help disseminating information, but also just to help to coordinate trainings and different webinars for the peers of Georgia, doing activities such as this one and being part of those sessions with DBHCD that had the peer voice perspective when coordinating and planning the rollout for 988. And with that, I will pass that on to our panelists. And I'll start with Miss Ruth Naomi, if you'd like to introduce yourself.
Absolutely, a pleasure to be here. My name is Ruth Naomi Escamilla. I am a peer mentor at Georgia Mental Health Consumer Network out of Region 3 at Georgia Regional Hospital. Part of the role that I play is one, not only having been received the support from 988 myself and being the evidence that recovery is possible, but also being that connection with continuity of care for peers, inpatient and outpatient, for a smooth transition into our community and to continue to receive support with post-crisis success.
Thank you so much, Ruth. And Miss Jean Olszewski, would you please introduce yourself?
Certainly. Thank you, Heather. Nice to see everyone and be here. Appreciate the Georgia Parent, or sorry, I just mentioned that. GMHCN, Emory, and Samson MHTTC for having us. I'm Jean Olszewski. I am a certified peer support mental health and cares, and I'm Director of Recovery and Advocacy for the Georgia Collaborative ASO, also known as Carillon Behavioral Health. We were Beacon. Some of you may recognize that name. So I'm Director of Recovery and Advocacy, and I get to do a lot supporting our peers via all our teams within the ASO, whether it be our quality management team, our care coordination team, our clinical team. And as part of the ASO, we have GCAL is under our umbrella contract, along with Clarent, who provides all the quality oversight on behalf of DBHCD for the IDD population. So that being said, we work closely with GCAL, and we just started with a 988 follow-up team here within Carillon and the ASO. So we're very excited about that. I've been here 9 years, and prior to that, I worked with the Georgia Mental Health Consumer Network at the Peer Support Wellness Center in Decatur, where it's greater, and also supported via the warm line. So thanks.
Thank you. And Ms. Mahogany Ellis, if you can introduce yourself, please.
Good afternoon. My name is Mahogany Ellis. I am the crisis coordinator with DBHDD, or should I say Department of Behavioral Health and Developmental Disabilities. Work out of the Office of Crisis Coordination. Quick overview, we do a lot, but an overview of what we have going on is that we oversee our crisis system. So making sure our crisis units have what they need and getting the resources they need. And then we also oversee the implementation and ongoing process for 988. And so we are, as we come up to this 2 years of 988, we're continuing to do the work and making sure that we are getting 988 to those who need it. And so do the work kind of behind the scenes for 988 as well.
Thank you. And I have Catherine Cosette. Good
afternoon.
Correctly.
You did. You pronounced it correctly. Yes. Good afternoon. I'm Katie Cussett, and I'm also with Caroline in the Georgia Collaborative ASO. And my role in the ASO is to manage the Georgia Crisis and Access Line contract for DBHDD. And so we were, very instrumental in helping to usher in 988 a year and 8 months ago now, and making sure that GCAL was ready and and they would be able to handle all of the additional calls that would come their way.
Thank you so much. And we have Tony Jackson.
Good afternoon, everyone. My name is Tony Jackson. I am the Director of Community Response here at PAD, which stands for Policing Alternatives and Diversions Initiative. I manage the teams of responders that go out and respond in the community. And it's nice to be here.
Thank you guys so much for the introduction, and I'm going to pass it back to you, Chris Johnson.
Okay, thank you, ma'am. And thank you, Tony. I imagine that you guys over at PAD have been doing this work, like actually out on the streets with folks for a little longer than some others. I'm not sure when crisis intervention actually started here. Jean, do you know that off the top of your head? When we started crisis intervention teams in Georgia?
Pass. Call a friend.
Call a friend, lifeline. Sorry about that. No, we don't need to know that today. But what we do need to know is how this works, right? So how does 988 work? Who wants to give us the 2-minute synopsis of how we get from person having a moment of concern to people arriving there to support that person? Who can handle that one? I'm sorry, that wasn't the first question on the list of questions I sent you, but I acknowledge that. But who can answer that for me? Mahogany, you want to go? Is your hand up? Yes.
Yeah, I'll definitely can to answer this one. Well, I think nationally we now have 988 in place, and so you can be at any state and be able to call 988. And so how it works here in Georgia, we have 3 main buckets that we focus on, and which is have you guys been doing your series, someone to call, someone to respond, and somewhere to go. So using 988 will ensure that if you are in a behavioral health crisis, that you have somebody to respond, somewhere to call, and then also somewhere to go. Is that's short enough for you?
That is perfect. Thank you for that. Because I have heard from some of our partners that they're planning to use this series as a training piece when they're onboarding you folks. So I'm trying to make sure we're covering some of the bases in each segment. So from there, I think we will jump back to the sort of questions I sent you earlier, because we do like to lead with strength, right? In all the work that we do here at the network. And so what I want to do is ask those of you who are doing this work, even if you aren't frontline, what do you like most or love most, if you love anything about the work you're doing, supporting people on the front line, but also just supporting the work, because it's important that, the frontline work is important. So is the back office stuff that makes it all happen. So I want to hear from everyone, but why don't we hear first from Tony? Why don't tell us what you love.
Well, you must want me to talk all day long and take up all your time, because I literally love about my job. I love street level outreach. I love meeting people where they are. I love leading with empathy and compassion, which is what we do at PAD. And I love just being able to care for our unhoused neighbors, neighbors struggling with mental health or substance use concerns. Of course, just the poverty level is out of control right now. So anytime we're able to assist someone with even just a meal, I am happy. The other side of that is I love the opportunity to influence and mold the community's perspective and mindsets around poverty, mental health, and substance use concerns. Here at PAD, we literally call any community member back that calls and makes a referral. If they leave their contact information, we let them know what happened during our engagement with the person that they referred. And I love making those calls to say, here's what they needed. Here's what we did. It was because you were concerned. Please call again. In the event that we weren't able to assist the person or they weren't interested in assisting that person, I like to be able to advocate for that as well. They've had horrible experiences in shelters. They might not feel safe in a shelter. So just having that time and opportunity to speak with and educate the community on the actual situation that we're handling right now is probably my favorite part of this job.
You're right, that was a lot. It's amazing. And just so interesting that I sometimes in this work, because poverty isn't something we focus on directly at the network, or it hasn't been in the past. And I love that whenever I'm on a call with Pat, I'm reminded this is a problem, right? So thank you for that.
You're welcome.
Let's see, how about Ms. Ruth Naomi? What can you add to that? What do you love?
Well, one, community connections and the collaboration, knowing just the uniqueness that every individual, that every organization plays in ensuring that you're not alone, that you don't feel alone, and that, you can have goals, that you matter, and that there's safe space for you here in the community. And not only that, but, as you work together, it's like the resounding change, no matter what the stigma has been placed on mental health, you now change the narrative, working together with the community and with peers, and that alone just helping people identify their own strength, identify their own goals, and empowering people to take ownership in their journey of recovery, and sharing that that I am too the evidence that recovery is possible for all of us, and paying it forward is part of the best part in my job.
Awesome, thank you. Mahogany, anything you'd like to throw in?
Yeah, I think for me, especially now in my career, because I've been doing this for 20-something years, but I think working for DVHDD, having a seat at the table to share my experience about people who look like me and why that matters, how we, continue to engage certain populations, making sure that we are culturally sensitive, and not forgetting the importance of those aspects when we're talking about behavioral health. So I enjoy this piece to kind of be behind the scenes and looking at our policies, and having a voice to say why this doesn't work for certain groups and populations, and just having a voice at the table is really important to me.
Awesome, thank you. Jean, how about you? Or Katie, your hand is up. You want to go ahead?
Yeah, I just wanted to mention something from a little bit of a different perspective. But one of the things that I think has been so wonderful to see is really how government and funding is really putting money into crisis now, and really recognizing the importance and the need of it. So I think that's something that's so different. And the other thing is different organizations that have maybe never really knew how to deal with mental health crises, we're all coming together because we have to work with different agencies to make this work. So for example, we've spent a lot of time with 911 and really learning from each other. 911 rolled out a long time ago, but they were able to teach us a lot of things about how to roll out 988. And we've had to work together with 911 to really talk about, well, how do we transfer calls back and forth to each other? How do we work together to make sure that we're identifying what is a true mental health crisis versus something that maybe just needs law enforcement? And that's just been really nice to see.
Well, awesome. Okay, Jean, you want to go next? Or do you have anything you'd like to add?
Well, I do, just from the standpoint that I love hearing what everybody's saying, and I'm hearing a thread of connectivity or connectiveness. And I think that's really important from what, Tony mentioned, Ruth, Mahogany, Katie, about really engaging first with the person that needs support or is asking for support, or whoever may be calling in for them. And I see that from my perspective, I get to kind of thread that needle from both sides of it. On the policy side, I get to have some input, and which is really cool. And then also, I'm boots on the ground supporting our team members that are doing the follow-ups, that are meeting with peers who may have needed to go inpatient and wanted to go inpatient. And I met with one individual a couple of weeks ago, and he really wants the services. Of course, they're still scared a little bit, but really to be able to give that empathy and connecting and hope, of course.
Awesome. Thank you, Jean. We're going to move a little forward here, just to hear from, let's see, which of our frontline folks would like to give us just a sample shot in the, just a snapshot of what a typical day in your life looks like. Do you go into an office? Do you work out of your car? Do you walk the streets? How do you do your job? Let's see, what do we say? Ruth Naomi, you want to tell us when you now are, what does it look like for you?
Well, one, my day starts off with checking in with myself to make sure that I can be of best of service to others by making sure that I'm best of service to myself. I work out of my car, transitioning from the hospital and into the community. But a lot of that is making sure that I'm equipped with the tools that I need. So that I'm sharpening my tools, because there is no cookie cutter approach. One person that I might meet in the hospital, they might not have been completely stabilized, but they know that they need support. And so just having that empathy, and being teachable, so that I can also learn from each peer that I support. Every situation is not the same at all. Some peers do have a lot of family support, so the transition into the community may be easy, but some peers don't have any support at all. And also they might be transferring into a community where there isn't a lot of resources there. So, being able to connect with your allies and getting them the needs that they need, and being creative, but not only that, allowing each individual, every peer that I support, to play the #1 role in what their recovery is going to look like, and letting them know that it is the life of their choosing, but it is important and it is valuable and it is achievable. And that relatable experience that we have, it just continues to strengthen the bond, not just with the people that I work with, the treatment team in the hospital, but also in the community and all of the community service providers that we connect with, to make sure that every peer has their needs met.
Great. Thank you, Ruth. Let's see, who do we have? Tony, do you want to let us know what your day looks like. Like, what do you do? And I think you gave us a little bit before in your intro, so I won't ask you to repeat all of that, but just like,
Really up your whole day. Well, I report to the office, check in with staff. We have what we call shift huddles, pre-shift huddles, where we just talk about what's on the agenda for today. We have a lot of different projects simultaneously happening all at the same time. So it's a lot of keeping things organized, letting the team know the expectations for the day, the tasks for the day, ensuring we have all of our supplies. It's lots of supplies. The teams respond with clothing, food, any harm reduction items, really, Narcan, things for substance use. We have diabetic kits for when we engage diabetic individuals on the street, cooling items in the summer and warming items in the winter. So just making sure our supplies stay fully stocked. And then a lot of it is just, for me now in this director position, is a whole lot of meetings and planning and logistics. But on any given day, I'm a responder. I'll hop in the van and go respond with the team when we're short staffed. On any given day, I'm a referral coordinator if one of them is out and we need coverage there. So it's a lot of juggling on my end. My days never look the same.
I understand that very well. I was a provider of direct service myself, so I know.
Never a
Never a dull moment. Let's see. Let's talk to hear from one of our back office folks. Mahogany, what's a day like for you at DBHCD?
Surprisingly, it's different every day as well. Some days are strictly meetings and talking about, the data that we're receiving from 988, kind of how we want to move forward, looking at that data. It might be a marketing plan that we're working on, trying to develop to make sure we're touching our high-risk population. It may consist of meeting with like the regional offices and see what's going on with them and supporting them. It could be going to a site visit and looking at a new build that we're in the process of assisting and coordinating with, so there's a lot of different things that we have going on that we're kind of all in the mix of. And as some of my counterparts mentioned, this is something that, you don't do alone. And so building those relationships and partnerships with the different other organizations, we meet with Caroline on the regularly now to talk about different projects. And so making sure we're still really communicating and collaborating with each other to make this thing keep going and keep churning as well as it is.
Awesome, thank you. Would anyone else like to chime in on that particular topic? Okay. Let's see. We'll start just on average. Ruth, how many calls or how many responses do you have in the community each week? On average,
Well, Region 3 in Decatur, it has a high demand. So I am supporting almost 40 peers by myself. And I am transitioning from 6 units. So I'm bouncing around all day long, and also out in the community. Because you have people who have actually settled into the community, have housing support, but then there's people that are just transitioning and have nothing. So making sure that you're connecting, with community allies and cooperation, the Goodwill, food banks, contacting, different housing authorities, trying to get them housing. So making sure that they are in day groups, connecting them with the respite center, different services, that they can even have a phone to utilize, to have the ability to even access their resources, connecting them with MARTA. So my day stays full.
yeah, it sounds like 40 sounds like a lot. When I was teaching, I couldn't remember the names of 40 students, so hats off to you. Let's see. How about you, Tony? How many on average would you say you respond to a week?
It's between 35 and 40 calls a week, and that's strictly from the community referrals coming from the 311 line. That's excluding diversions coming directly from law enforcement. For them, I would say maybe 4 to 5 a week diversions come from law enforcement. The bulk of our calls are coming directly from the community. And then we've also started a new initiative where we are diverting calls directly from the 911 center. And those are kind of classified a little differently. And I would say we probably get about 10 of those a week. So on average, maybe 50 calls a week.
So now are those coming from the like PAD staff that are embedded in the 911 centers?
Correct. Well, we have that staff embedded in the 911 center, basically just to keep an eye out on what is PAD appropriate and what they should be transferring over to us. So it's not necessarily we're clicking on anything while we're in there, but we will walk up to the supervisors of the 911 center and say, hey, this is actually really great for PAD. You guys should forward that over to us and we can respond to it instead of the officers.
Okay. Okay, so that prevents that call from going into 988.
Correct.
Okay, sweet. So yeah, there's lots of diversions going on here, right? Lots of things to follow. Seems like, yeah, it's a lot to keep up with. In terms of, and let me see here, Katie, you may be the best person. As how many like 988 calls, or how many times a week would you say that a team is sent out from a 988 call? Like someone calls 988 or gets routed to 988 and the team ends up going out. And what are the kinds of teams that would go out from a 988 call?
Okay, I can tell you, so the Georgia Crisis and Access Line, also that's where the 988 numbers are routed through. So they average 20 to 23,000 calls a month, probably. And then maybe between 5 and 6,000 of those are coming in through 988. So they assess the call, they determine if there is a need for mobile crisis or if it's an active rescue, which means that requires law enforcement. And probably 20 to 30% of those calls end up in mobile crisis. And so what happens is they make a referral over to mobile crisis. And even though it's the same company, it's two completely different programs. So they make the referral over to mobile crisis. Mobile crisis has a warm handoff for that, and then calls the folks to say, okay, give me an update. How are things going? Here's our ETA. They try to get it there within 60 minutes, if at all possible, sometimes not possible. And then they go out from there and assess the situation to determine if this person needs a 1013, they need hospitalization, they just need additional supports, they give them referral information. So around 20 to 30%.
Right. Anyone else have anything they'd like to add, like just in terms of numbers of folks calling in? And I guess the question I have for you, Katie, is like, how different is that number from maybe 5 years ago? Is it, I mean, I know Georgia's population is growing, but it seems like access to like through 988 and other sources, and even 311 in Atlanta, that more people are utilizing more services in terms of emergency or crisis response.
Yeah, I have the last 3 years in front of me that it hasn't varied a whole lot, actually.
Okay.
And it's still not, we're still not seeing a huge influx of calls coming in through 988 that we actually anticipated that we were going to see. So one of the strategies initially was to not market it too much, because we didn't really know what it was going to bring. So, we had a lot of discussions with DVHDD about, do we go ahead and announce this from the rooftops, and, are we going to be prepared for the influx of calls if that happens? And so it was a slower kind of rollout. And DVHDD Mahogany, I'm sure you can speak to this better than me, but did some targeted marketing in some particular counties in Georgia, to try to see, okay, let's test this out and let's see what happens. And I don't, the results were not drastic changes, were they?
So yeah, I was gonna say that while the volume may have not necessarily changed, because we have better optics and we're pulling different data points, we're able to look at the volume differently. And one of the things I think we notice is that while we think Region 3, right, the metro Atlanta area, we know that there's a lot of volume there. But when we talk about continue calls and same user, return users calling and information like that, we recognize that our rural populations are definitely one population that is utilizing the 988 service. And so I think, you know, we're able to look at the data points a lot differently to help us identify how we're going to target the populations that are really utilizing the 988 number. And so I think that's one of the biggest differences and things we're able to pull out of there and target that specific populations.
And a lot of that speaks to, in those rural areas, there's of course less mental health providers. So there's less access to services there. So, you know, calling 988 may be one of the only options.
Yep.
And I'm going to add to that as well, that to that last point, Katie and Mahogany, is that there's a lot less stigma. I mean, there still is stigma, but, you know, in the rural areas, especially the agricultural community, we're finding out, and, you know, farmers, which Georgia has quite a few, are realizing that mental health affects everybody across the board, and it's okay to ask for help. So that's a big piece of it, I think. And then also, piggybacking on something else, is that there was a soft rollout nationally. So it wasn't just, you know, Georgia acting in a cocoon, because SAMHSA, who, you know, basically owns 988, said that 911, to be honest, is still not rolled out 100% across the country. So that gives you an idea. We all know 911, right? But there's still areas that doesn't have access to 911. So building on that and realizing, you know, let's make sure that we're doing this correctly. Georgia was at an advantage because we did have GCAL. A lot of states didn't have any system, so we were at a huge advantage of that. But nonetheless, it's still a let's do this right. So kind of holding back on the reins, and I think that's indicative of the response that we're able to and how we're able to support people that are calling.
And while we're on the jumping back a little bit, just shout out to the faith community in Georgia for stepping up. The first year that the rural farmers were experiencing what was really kind of a little mini epidemic in Georgia, the faith community really stepped up to the plate and did a lot of work around mental health that we hadn't seen them do before. So I was happy to see that. Moving on, switching gears just a little bit, with some nuts and bolts for those of you who have received training. What training that you received has had the most impact on your ability to successfully provide peer support? Like, if you could only, and even thinking back to your CPS training, if you are a certified peer specialist, like which module or which day that training was most impactful. You don't have to remember the title of the section or whatever, but like, what was impactful to you? Let's see, how about Heather? How about you? We haven't heard from you in a minute, and you provide some peer support in your time, lady. So how about you?
I think for me, when looking back at my training, some of the modules that were most important, one of it's just going back to like that like the art of effective listening. You know, really just learning how to listen to the individual, you know, and to make sure that you're like listening for understanding and not listening to respond.
All right. How about you, Ruth Naomi?
Just like, you know, Heather said, is that effective listening portion. But one of the things that was so effective for me is the tools that were provided in CPS training, you know, like RAP, That for me, it has been like, I've been carrying on the baton because I knew I had a mental health diagnosis, but I also didn't know how other things related to that affected me in my everyday life. And that's something from a humanistic approach that we all deal with. It doesn't matter who you are. And so learning that was a valuable piece for me to continue to carry on the peer support.
Thanks for that, Ruth Naomi. Tony, how about you?
Full transparency, I can't even sit on this call and say I have a lot of formal training in this field. Now, I will say I pull every day from my lived experience in this field. I have multiple family members, loved ones that struggle with mental health issues, substance use concerns, poverty concerns. So I've been navigating this field literally my entire life. And I would have to piggyback off of Heather, because when you first asked the question, my first answer was listening. Just learning to listen to people is literally the best thing you could do to do this work, with no judgment, without bias, listening for understanding for sure, and really being vulnerable enough to relate to one another. When people feel seen, when people feel heard, when people feel understood, you get a different response from them and you can better support them. So that's my answer.
Okay. So have you been through CPS training?
No, I just had an employee that just finished it, Rachel Green. I'm sure you're familiar with. And she showed me some of the stuff that the book that you guys are working out of and everything. And I said, oh, now I have to go and get this certification.
Yes, you do. Yes, you do.
Definitely going to get that certification for sure.
All right. Let's see. Who else do we have? Jean Olszewski, why don't you tell us?
So
and you can't say documentation.
To say what?
You can't say documentation.
Yeah, thank you. That's just so you know, that's one of the trainings that we provide on behalf of DBHD to all the peer guilds is documentation. And believe it or not, documentation can be fun, y'all. So when you first asked this question, Chris, I was like, oh heavens to Murgatroyd. I think I have been a certified peer. I'm 16 or 17 years now. And I just quickly listed a couple. One was the stages of change and/or the readiness ruler, motivational interviewing, and using self-disclosure effectively. Because I wasn't real familiar with any of those. That's, behavioral health peer support was not in my background prior to becoming seeking services and then becoming a certified peer. So to effectively listen, to effectively ask questions, to effectively use my story and not start from the beginning of, oh, so when I was 7, a squirrel stole my mitten, and move on from there. It's effective used as it relates to the situation our peer may be experiencing. So I think those, and of course documentation, just gotta drop that in there. There you
go. Thank you, Jean. You never disappoint. Let's see, and what thinking about not just your own experience, but your experience of the peers around you and systems folks, I want to hear from you too on this. Like, where do you wish we had more strength? Like as a system, as a team, as individuals even, like where do you see an opportunity for us to develop or create or bring in trainings to bolster the really strong system we have? Because I believe our system is strong. I have seen it at work. I know we do good work. We do great work. But there are always opportunities for improvement, and I'm wondering where you all see them. Let's start. Heather, you're director of training or chief of training. You're our chief of training and development. So where do you see the gaps or a gap or an area for improvement?
I'm on the spot. Let me see. Where do I see an area for improvement? So, um, one big area that I see for improvement when it just comes to like training, especially when it comes to our certified peer specialists, I think it's that supervision piece of it. There are so many of our CPSs that are working and they're being supervised, and they're not necessarily being supervised by a CPS themselves. And so I think learning how to properly supervise a person who is working in the behavioral health system that has lived experience and understanding what actually a certified peer specialist does, what is peer support, so that people are able to stay within their role. They're not being shifted outside of their role and becoming something else besides a certified peer specialist. I think there's still some training that we need to do there. As well as how we just support our certified peer specialists in the field to make sure that they're able to provide adequate services, but maintain their recovery.
Yeah, one thing the Georgia Council for Recovery did in the past, I'm not sure if they still do it, but supervisors were invited to the final day of training. And they would show up and frequently know nothing about what the person that they had sent was being even trained in. Like they just knew they had to have it and they had to have this credential, et cetera. And, and sometimes they'd be blown away and sometimes they wouldn't be there at all, because it was an invitation, it wasn't a requirement. But I think it was really helpful. And I wish that there was a way, especially and we talked about it early on in the pandemic, like how can we leverage this Zoom technology to bring in more supervisors to at least part of the training. And we never quite got there because there were lots of moving pieces, as you all know, throughout the pandemic. But I think it's something that we as an agency, or we as the group of agencies, could we look at, how do we get supervision bought into this for sure. Let's see, who else? Mahogany, where do you see a gap?
Yeah, I definitely agree with Heather. I think, while our school system does a really good job of educating us and getting us what we need, I think sometimes we've just got to get back to the basics of things. And so that engagement piece on how you talk to people and really meeting them where they are and understanding that this is their journey and not our journey. I think sometimes we struggle with modalities and doing it this way and this mode, and all of these great things that really help do the work, but really getting back to understanding of how to really connect with people. How do you get them to share their stories and open up? And I think CPSs do an amazing, phenomenal job with being able to bring that out of people and make them feel comfortable. I think we don't highlight that enough in this world because it really does make a difference. So I would say that piece of just getting back to basics and understanding what a hello and a thank you, how that could really go a long way in this industry. And I wish we would also just do more to highlight. We talk about all of the hard work that we do on the grounds, but also kind of the more of the happy times and really shed light on how positive this field is and what it really does to change lives versus all of the negatives that we kind of hear. I wish we highlighted more of that.
Okay. I can hear that. Ruth, what do you think?
I love what I do, and that's because I am the evidence of that, so that I take my role to heart. But part of the gap being a peer providing peer support is budget. Budget affects so many things, who we can reach out to, where we can reach out to, how far we can go, what we can do. It is known, it is out there. The peer support services is out there, and there's a need. I mean, I'm getting phone calls all the time in the community, that, there's a need from the crisis centers. There's a need, for post-crisis support. There's a need, from drug addiction centers. There's a need from the courthouses and the hospitals. There's a need. And unfortunately, the budget just doesn't fit the bill right now. So then, it kind of falls back on how much services we can provide, how much support we can give. But other than that, I feel that everybody from the top, what is here isn't broken. It's just that there's just not enough of it to give out. And so I feel like that is where we fall short as a whole. So getting that voice out there and that awareness that recovery is possible, what everybody is doing from 911 to 988 to the hospitals, to social workers, to doctors, to, peers, all the boots on the ground. They're working. We just don't have enough of it.
Thank you for saying that. So I didn't have to. Yay. Yeah, no, more resources are definitely needed across the board. Across the board. I don't know of any more resources are needed for sure. Now, Jean and Katie, you guys are on the other end. You see the results, you see the numbers coming through. Where do you see any like gaps for or opportunities for additional training?
One of the biggest gaps that I see is, or issues that I see is staffing. So we have a lot of trouble staffing the crisis lines, staffing them adequately. It's really difficult work, to listen to a call like that over and over again at somebody, oftentimes at their lowest moment. And, sometimes they're also getting calls where, people are yelling at them and they are, they're in crisis and they're upset about something. And so we have trouble. The hours aren't great either. A lot of times, you got to answer the phone in the middle of the night. You got to answer the phone on the weekends. So I think staffing remains one of the biggest challenges from my perspective in the position that I have. And I'm not sure that there's a great answer for that waiting somewhere. But I think that the job is what it is, but we certainly can pay people better, which would be definitely helpful.
Yeah, I think the answer to the employment crisis that everyone says, like, how can we get more certified peer specialists? Very easy. Double the salary. All the seats be filled next year.
Yeah.
Next week. There's the answer, but that's not the answer they want. So,
Sure.
Yeah, I think there's some truth there. Skipping ahead because we're running up on time because we always do. But I would like to hear self-care. I've heard we mentioned it briefly today, but I always want us to hear a little more about it. Ruth Naomi, you start your day off like being focused on being prepared, being present, and delivering the support folks need. What do you do to take care of yourself after that?
Grounding. The whole ride home, I ground because you do take on a lot. You can't just dismiss everything that people are throwing at you. You just can't. You're human, right? And so grounding and just appreciating the littlest things on my ride home it's priceless because it lets me know the reason why I'm above ground. And the reason why I continue to wake up is just priceless to me. And then I forget about all the other the weight that I took on that day, but just taking a moment to be still, not having to live up to or do anything or work hard, just being still, present in that moment. And so we talked about effective listening so that I can listen to myself. What is it that Ruth Naomi needs for right now, just for today? And that is the biggest part, because by doing that, not only am I able to show up for the peers that I support, but I'm able to show up for me. I'm also able to show up for my children, my kids, and everybody else who enjoys having me.
I know a number of grown-ups who need to take your class and how to do that. Listening to yourself. Oh, what a way to remind us. Let's see. Tony, how about you? what do you do to take care of yourself? You take all those packages out, you prepare for the diabetics and the folks that you meet on the street. How do you take care of yourself?
I definitely ground as well. I love to barefoot to earth, meditate, nature, hiking. I'm really, really big on hiking. I also like to paint. So I paint, I write, I journal. I have a lot of different, I eat well, maybe a little massage, spa day every now and then. I'm definitely huge on self-care. And it actually ties back into what Catherine was saying. One of the struggles is with staffing, because that is definitely a struggle. And we definitely are really big here at PAD to avoid burnout and to try to cut down on that turnover. So, well, we couldn't really give you a pay increase, but the PTO is very generous. Like, our people take off whenever they feel the need. Also just constant like checking in on my employees. So bi-weekly, I have one-on-one check-ins with them just to see how they're doing, what challenges they're having, ways that management can support, what supplies they may need to have their jobs be easier. But there's also a personal aspect to that check-in as well, right? Where they're able to tell me things that may be going on in their personal life that could be affecting their productivity at work. So just having those really frequent and consistent touch points definitely helps with turnover as well, because you're able to identify a problem and solve it before it's an even bigger problem. But then also like that, the generous PTO definitely helps combat the turnover and the burnout.
Yeah, we experienced the same thing here. We didn't have money for raises last year, but what we could do, we did do, and that is we have 35 days of PTO. And that includes like holidays and everything, but really 35 days is like standard busting from where we sit. Like we don't know of anyone with 35 days.
Yes.
Yeah, we love it. We love it. Okay, we're coming up on the end, but I would like to hear just from at least one person just real quickly, because we do have to have a survey real quick. If there's anyone on this call for continuing education credit, in order to get that credit, you're going to need to fill out a survey that will be introduced to you by Emily in just a couple of minutes here. But for one of you, without providing any personally identifying information, just well, actually, you know what? Why don't we say what keeps us hopeful? Because I feel like this was a very hope-filled, strength-based webinar today. I feel really good coming out of it, and I would just like to hear from you all. What keeps you hopeful? And I'm going to start. My word for what keeps me hopeful is a compound, y'all. And I will pass it to my friend Jean Olszewski. Jean, what keeps you hopeful?
No, that's introspection, meaning listening to myself.
Okay.
Because without that, I can't take care of myself, and I'm learning that. And that keeps me hopeful so that I can share that with others.
Catherine, what keeps you hopeful?
You know, I keep falling back on humor. So, you know, without that, I think and Jean and I work closely together. So that's why she's smiling. Or should I say sarcasm? Maybe is it not humor? It's sarcasm.
Yeah,
I don't know which
well,
one.
it's a stretch, Katie, but you know, I'm.
But yes, I think that keeps me hopeful.
Mahogany, how about you?
That's all right. I think just the know. I say the saying that my job entails me saving lives. And so that keeps me hopeful to know that this work that I'm doing is saving lives.
I like it. Tony, what keeps you hopeful?
Mahogany took my answer. So I'm going to have to say my kids, or in a more generalized way, the youth keeps me hopeful. Just seeing their potential. And if we catch them early enough, we can get them all in this work and not on the other side of things.
Amen. Heather, what keeps you hopeful?
For me, it would be just partnerships keeps me hopeful. Being able to just partner with other like agencies, whether they're state, private, nonprofit, and then just being able to partner with like other CPSs and our peers, because I have learned just as I'm providing services, I learn so much from my peers as well, and that keeps me hopeful.
All right. Thank you. And finally, Bruce, what keeps you hopeful?
Ooh, this right here. Being able to just openly share my lived experience with our community, and just normalizing, that it's okay not to be okay. It's okay to have a mental health diagnosis. It's okay to be part of your community. The possibilities are still limitless for you.
Thank you, Ruth. Thank you all for being here. We're going to turn it over now back to Emery, our good friends at the Southeast Mental Health Technology Transfer Center, who made this call possible, who made this work in a large part possible. We are grateful to you all for being here and for participating. And if you have any questions, please shoot them to us. I am Chris at gmhcn.org. And if I cannot get the answer off the top of my head, I will find an answer for you. Thank you all. Emily?
All right. Thank you so much, everyone. And thank you, all of you attendants and attendees for coming out today and being a part of today's webinar. Like Chris said, I have put the SAMHSA required evaluation survey link into the chat. So if you need a certificate of attendance for your records, please go ahead and fill that out by following that link. You'll be redirected to download your certificate of attendance after you fill out the survey. If you have any problems with that, just shoot us an email at info@southeastmhttc.org. And also, please join us in 2 weeks on April 29th for our final session in this 3-part series, 988 in every state. I have also put the link for the registration for that event into the chat as well. That's going to conclude today's webinar event. Thank you so much to all of our panelists for such wonderful information, such an amazing presentation. That's going to be it for today. Have a wonderful rest of your Monday.
Thanks, y'all. Be well.